Hi everyone, my name is Dr. Christina Tarantola. I'm a licensed pharmacist and certified health coach. And today I wanted to discuss for National Pharmacist Month, can you crush a tablet or can you split a tablet? And so often when I see patients coming into the pharmacy, they have these questions because a lot of the times you might have a need for a dose change, or the doctor might need to alter your dose depending on if it's a blood pressure medication or another medication like an antipsychotic, or, even a seizure medication. There's so many different fluctuations in doses all of the time. And even, in the case of crushing a tablet for a child, there are all these questions that come up. So I wanted to give you a little bit of information today, just to kind of provide you with a roadmap and a resource for you to tap into. If you ever have any kind of questions, you can always go to, it's a website called consumermedsafety.org, or, it's always best to ask your pharmacist. So that's really why this video is being brought to you, is because it's National Pharmacist Month, and we really want to highlight, get to know your pharmacist. Feel free to ask us questions, because that's really why we're there. We're there to help you work through any kind of, questions you have, any kind of issues. We're always there as your number one resource. So feel free to always ask questions. So I wanted to get into a little bit about, first, can you crush a tablet? And the reason why you wouldn't want to crush a tablet is because sometimes there's specific medications that have what's called an extended release mechanism in it. So I drew out a graph here, and, this is a perfect example of a medication that is a time-release medication. So if you look at this point A here, this being time on the x-axis and the amount being on the y-axis, if you think about it, say you take a tablet at time 0, and it's for example, metoprolol XL, which is a blood pressure medication. It's extended release, and it's meant to last over 24 hours. So you take the tablet at time 0, and your body absorbs it up until this point, and then it begins to eliminate it all the way down to the 24 hours. That's a normal graph for an extended release tablet. But say that you go and crush it, and you actually break apart the integrity of the tablet. So what happens is when you crush the tablet, this mechanism doesn't work anymore, and all of the ingredients that are built into that mechanism within the tablet get released all at once instead of over time. So that's what I drew over here on graph B. So say you were to crush that same tablet, starting at time 0, all of the medication would be released, and it would just be absorbed by your body. So I really wanted to draw it out, because sometimes people can get a better visual when they see it. So that's just one example. That in that case, the absorption would be altered. And there are a couple other medications that I wanted to give you a list of. So that would be one of them, metoprolol XL. That's a blood pressure medication. Another one that isn't a tablet, but it's a capsule, it's called diltiazem, and that actually has small beads in it that, if you actually break the integrity of the capsule, you release all of the medication as well. So, again, it's the same kind of graph here. If you were to just, break apart the capsule and sprinkle it into, for example, applesauce or yogurt or something, it would actually disrupt the whole function of having the time release component. Excuse me. So diltiazem is one, verapamil is another one. Any medication that says extended release or XL on it, those are usually some of the hints, the ways that you would know if something is extended release. It'll either say sustained release, extended release, something like that. Another reason why we really want to highlight, why it's so important to really pay attention to, do I crush this pill, do I not, is because sometimes it can actually result in a fatal overdose. And I actually listed out something here. It's a tablet called Exalgo. It's a pain medication, and it's a time-released hydromorphone, which is a pain medication. And if you crush that tablet, it can actually result in a fatal overdose. That's really why this is so important, is because we want to provide you and patients with all of this information so you're ready to, be as safe as possible, and that you don't, wind up hurt or in the emergency room, God forbid. So it's really important to really know your pharmacist, stay engaged with the pharmacist, always ask questions. That's why we're there. And, feel free. That's why we're there. So the Institute for Safe Medication Practices, the ISMP, has a whole list of these medications that you can't crush or break apart. So that's a great resource, and pharmacists have access to that, but patients can have access to it too. So that's a great tool to use, and that's how what we were trained in pharmacy school to learn more about is this whole list of medications and the reasons why you can or cannot crush them. As far as splitting a tablet and knowing whether or not you can do that, it's always best to ask the pharmacist and just double check, especially if you're changing a dose in a medication like I mentioned before. So thank you so much, and I hope that this video was very informative and that you get to know your pharmacist for National Pharmacist Month, because we are there for you in terms of support and information. And we're actually one of the most accessible healthcare professionals out there for you. So thank you for watching. Again, my name is Dr. Christina Tarantola, and I hope you guys have a great day. Thanks.